Unfortunately, South Africa has an unacceptable number of intoxicated drivers on our public roads. This directly results in preventable road traffic accidents and loss of lives. The prosecution rate is also not where it should be, and one of the important aspects related to successful prosecution is the examination and collection of specimens for alcohol content determination of the intoxicated driver. The short time window of 2 hours available for the collection of blood alcohol sample adds to this dilemma. Often, this important responsibility befalls junior doctors and nurses. The examination can be daunting, and adequate training is the cornerstone to ensuring the accurate and appropriate information is available in the court of law. A proper recorded examination, together with a correct, timeous collection of a blood alcohol concentration, can aid in the correct verdict, regardless of a legal blood alcohol concentration allowed, which may change in the future. The sober reality is, however, even below the legal alcohol limit, an average person may appear normal clinically, but the reaction time is slowed down. Currently, the National Road Traffic Act 93 of 1996 states that no person, while under the influence of an intoxicating liquor or drug having a narcotic effect, shall drive a vehicle or occupy the driver's seat of a motor vehicle of which the engine is running on a public road. The current legal alcohol limit for driving is 0.05 grams per 100 ml of blood or 0.24 milligrams of 1,000 ml of breath. According to the Criminal Procedures Act 51 of 1977, a registered medical practitioner or nurse may obtain a blood sample from an arrested, criminally charged, or convicted person if requested by an officer of the law. The arrested person for the suspicion of driving under the influence is brought to a facility where the medical practitioner or nurse should receive a written request for the examination for the arrested person. Currently, the form is known as an SAPS 308A. Since the accused is under arrest, their consent is not necessary, and the arresting officer may use reasonable amount of force in order to assist the doctor or nurse in taking the blood sample. However, as with any other medical examination, the patient's welfare is paramount, and it is accordingly advisable that the patient's consent be obtained as far as possible. This consent can be tacit or implied. If no arrest has been made, the healthcare worker is under no obligation to do such an examination. The arrested person is entitled to request their own doctor or legal practitioner to be present at the examination and/or examine them. However, in exercising this right, the examination should not be delayed beyond a 2-hour limit while awaiting their arrival. Without further ado, let's proceed to the re-enactment. The characters in the short form are all acting, and this is not a real arrested intoxicated driver.
Come through, Mr. Hall. You can just stand here for me, please. Hi there, Doc.
Hello.
How are you?
Okay, and you?
Good, thank you. Can you please assist me here? I've got alleged drunken driver.
Okay, yeah,
for
sure.
the blood test.
Yep.
Mr. Hall, you can go in.
All right.
Thank you.
Morning, Doc.
Hello, I'm Dr. De Villiers.
I'm Mr. Ethan.
Mr.
Ethan Hall.
Ethan Hall, thank you. Can you uncuff him fast, please?
No problem.
Thank you.
It is important to try and maintain the dignity and privacy of a patient as far as reasonably possible. The safety of the staff is also paramount, as many intoxicated patients may become aggressive. You may even need to call in additional security, so be aware of this. If a law official does step outside the room, make sure to ask him or her to stay just outside the door and leave it ajar, and always ensure there is another person present, especially if they are uncuffed.
Sir, could you just move around for me? You can stand still.
Okay.
Lovely, thank you. Mr. Hall, you can take a seat just while I speak to the officer. Thank you.
The examination of an intoxicated patient starts as soon as a patient enters the examination area. See how the doctor continued to observe a patient's gait from the moment he entered the room to the point of sitting down.
Officer Hopper, can you explain to me exactly when and where the incident took place, please?
It happened in between the corner of CL and Woodstock Main
Okay.
at about 11:05. And then the arrest happened at 11:15.
Perfect. And you came in at 12. So was he involved in an accident?
He drove into a traffic light.
Oh, okay. Did the airbags in the
No airbags.
And any side impact to the car? Or was
No,
it
it was a head-on.
Okay, perfect. Do you have the 308?
Yes, I do.
Ah,
There you go.
thank you. Okay, so I just need to fill in my details there. And then I'll give it back to you to sign there at the bottom. Thank you.
All right.
Thank you.
Asking the patient his name is a good way to start assessing speech and orientation while maintaining his dignity. The time is crucial in the examination to apply the Whitmark formula, especially for establishing the level of alcohol concentration at the time of arrest, as this is important in court. The sample must be taken within 2 hours of the alleged incident, as mentioned.
So, Mr. Hall, sorry, what did you say your first name was?
Ethan.
Okay. And how old are you?
I'm 41 years old.
Okay. What's
Yeah.
your date of birth?
It's 20 February 1980.
Okay, perfect. And what do you do for work?
I'm actually in accounting, but currently kind of in between jobs, you know.
Okay, perfect. So the officer brought you in because they suspect that you might be over the drink drive limit. Okay, so they
Alright.
asked me to do a quick examination, and also we need to take a blood sample just to actually determine your blood alcohol level. So a couple of things I need to explain to you. It's not a normal doctor-patient situation because in this instance you can't actually refuse the blood being taken. by
Really?
law. Yeah, so the law gives us the right to actually take the
Sure.
blood. But if you cooperate, it's so much better for all of us.
Okay.
And then secondly, we don't have the normal doctor-patient confidentiality because I have to write all my observations and findings down and then give it in a report to the police.
Ish.
That becomes part of the police investigation. Okay?
Okay.
But,
Doctor, I trust you. I will cooperate with you today. Okay.
Lovely, thank you. So I think we'll do the blood sample first and then we'll go on to the examination.
All right.
Have you had a blood test before?
Long ago, yeah.
Okay. Can I have the kit, officer? Sure. Thank you so much. Just, yeah. The expiry date is perfect. Thank you.
It is essential to draw the blood sample as soon as possible before the clinical examination, as this will give a more accurate depiction of the concentration of alcohol in the blood at the time of the incident and arrest. The collection and sealing of the alcohol kit in the presence of a patient and the law enforcement officer by the doctor and nurse is important for the chain of custody. Note that it is not the function of the officer to secure the sample. They did not collect it. The blood alcohol concentration forms a crucial part of the evidentiary procedure.
Okay, let's have a quick look. So it is now 11 minutes past 12 and I cut the old seal. Here you go. So let's have a quick look. Here's our needle, here's our new seals. And then there's always a little bit of powder in there. Can I borrow your left arm?
Yes, doctor, you can.
Thank you. Let's see, I'm just going to put up your sleeve.
All right.
There you go.
Will this hurt, doctor?
It's going to hurt a little bit, but it's only like a small scratch. It's only for a few seconds.
Okay, I trust you. Thank you.
I only need to get 2 teaspoons
Thank
of
you.
blood. Okay, so just going to clean the skin with a little bit of water.
It is vital that no alcohol swabs be used for this purpose. Theoretically, it may have an effect on the end result of the alcohol analysis. Acetone is to be used, and if not available, water.
you go. Now, just give me a second, I'll just put my gloves on.
What is the blood for again, doctor?
So this little vial of blood will go in the kit and then I give it to the police. The police will take it to the lab and then they will check the blood alcohol levels.
Okay,
in the blood.
all right. That should be fine.
There's a good vein there.
Mm-hmm. I'm healthy and strong. I'll look away,
So,
doctor.
yeah, don't look. Small scratch. Sorry.
You're good, doctor.
Perfect.
You're getting some. Can I look?
Come on, quick. That's it.
Oh,
There you
dear.
go. Perfect.
That's a lot of blood, doctor.
I know. There you go. Thank you.
Okay. Thanks, doctor.
That's cool. While I'm pressing there, I'm just going to tilt it a few times.
All right. Whew, glad it's over.
Yep. There you go. Can you just put your finger there for
All
me?
right.
Thank you. Lovely. Just going to put a little plaster on there for you.
Okay, thank you, doctor.
Lovely. Let me just quickly see.
All right.
Okay, excellent.
Thank you.
And then I'm just going to fill this in.
See how the doctor rechecks the seal numbers and correctly jots it down in the presence of a law enforcement officer.
5-3. We don't have a subs 13 number yet, usually. No. Thank you. And the time was 12:13, and it was the 26th of March. Can you come and sign here for me, please? Perfect. Thank you. So, I have to take this carbon copy sticker that goes on the top. These little ones will be used to seal the sides. And then we put it all back in. The old seals go back in the box. Someone's a bit of a $1 million challenge. Do this first. We will call that the seal time, which is 12:20. Thank you, officer. Handover time, 12:23. You can wait outside, we'll just do a quick examination.
Sure.
Thank you. Okay, Mr. Hall, thank you for that. I'm
Pleasure, Doc.
just going to ask you a few questions, just a little bit about your medical history, and then we'll do a quick examination. Okay?
Okay.
Do you have any medical problems? Any asthma, epilepsy, diabetes,
No,
high blood
no,
pressure?
Doc, no.
Nothing.
Some medical conditions can mimic intoxication and are important to note, such as epilepsy in the post-ictal period or hypoglycemia in diabetes, to mention but two. If any serious underlying medical condition is present, never allow the person to be detained in custody and refer them to an emergency department for further observation and management. Remember to rule out any acute injuries too, such as a head injury.
Are you on any medication at the moment?
No, Doc.
Okay. Have you been taking any other over-the-counter medication or any?
Not that I know of. No, Doc.
Nothing in the last 24 hours?
Medication? No.
Thank you.
Some medications have a suppressive effect on the central nervous system, and alcohol can enhance the effect. Before a court hearing, it is recommended, therefore, that the doctor or nurse do research and find out what the direct effects and the half-life of the medication in question is.
We'll do a quick examination. Did you injure yourself at all when you bumped into the traffic light?
I can't remember, Doctor. I don't think so.
Okay. No vomiting?
No.
And have you had any operations or any injuries in the past?
Long ago, I broke my left leg in a bike accident, actually.
Oh, okay.
Yeah.
And did you need an operation?
No.
Okay.
It's fine now, actually, Doctor.
Okay. How many years ago?
Like 10 years ago, I think. Yeah.
Asking about previous injuries is important. Previous limb injuries, paralysis, neurological defects, or brain injuries may influence the coordination test, the gait, intelligence, nystagmus, memory, behavior, and so forth. Previous surgery, such as gastrointestinal tract operations, shortening the gut, could influence the alcohol absorption, and therefore the blood alcohol concentration may peak earlier. Back calculating the blood alcohol concentration with a Witt mark in certain cases may be very difficult or even impossible, and the result will therefore not be a true reflection of intoxication level during the incident. Eye conditions may influence vision, and balance again may be influenced by ear conditions.
And do you use any drugs?
No, Doctor, I don't use any drugs. Okay.
And I need to ask you a little bit about your alcohol consumption in the last 24 hours.
All right, yeah.
But it is a voluntary statement, so when I document it, it says that that's actually up to you if you will answer me or not.
All right.
But I would like to just ask you if you can tell me what have you been drinking in the last 24 hours?
Just a few beers and some brandy, basically.
Okay. How
Yeah.
many beers?
Maybe 2 or 3.
Okay.
Yeah.
Okay. And what time did you start drinking?
It was me and my friend. We got together maybe like 11 o'clock last night.
Okay.
We were just relaxing and open up a few beers, maybe 2 or 3. And then as the night went on, we were relaxed, but we had some brandy.
Okay.
Maybe 1 or 2 bottles of brandy.
Okay. And what time was your last drink?
Yeah, the night went so quickly. This morning, I think it was like around about 10 o'clock. I noticed that I need to get home, you see?
Okay.
Most people will provide you with accurate information as far as quantities are concerned in the majority of cases. Time of drinking and type of liquor may be correct. Some recall, such as accurate quantity, may of course be influenced by the amount of alcohol consumed. This information may give the examiner a baseline to depart from as far as time is concerned. Time is of essence in alcohol calculations.
And when did you last eat?
I think it was like 7 o'clock last night, doctor.
Okay. And what did you have?
It was a pie, chicken pie.
Okay.
Yeah, I
Thank
think.
you. Thank you. Perfect. Mr. Hall, I'm just going to do a quick examination if that's okay with you.
Okay,
I
doc.
see the nurse already did your blood pressure and your temperature, and she also took your blood sugar and she weighed you.
All right.
Just have a quick feel your pulse. Thank you.
After the blood alcohol concentration collection, the doctor then proceeds to the clinical examination. The body weight of a patient is essential for the formula calculation later. Blood pressure will confirm or rule out previous allegations, and temperature readings may reveal pyrexia. A marginally increased pulse may be influenced by the alcohol itself, and also that the subject will try to outperform themselves during the examination, and additional adrenaline may be responsible for the tachycardia. Injuries could have been sustained in a motor vehicle accident or as a result of resistance to arrest. Careful documentation of these injuries needs to be done. Compare the characteristics of the wounds with the allegations made by the subject. If injuries noted, consider completing a JTA2, or at minimum make additional notes on the GW 754 and clinical notes on the hospital file. If serious, refer to emergency unit for observation. Alcohol is known for its vasodilatory effect, and redness of the face is indicative of this. Do not confuse this with sunburn, pyrexia, or other conditions. Alcohol is an almost odorless, colorless liquid. So what do we really smell? The odor, which is detected, is most of the time aromatic substances in the specific liquor or the metabolites of alcohol. This aspect of observation is debatable. The smell is dependent on the capabilities of the examiner, and smell acuity differs from person to person. Furthermore, the smell of alcohol is an indication of the fact that the alcohol was consumed during the period before the examination, but gives no indication of intoxication levels. Certain liquors, like vodka, have a lesser odor than, for example, sorghum beer. Alcohol is known for its vasodilation, as said above, and this is clearly visible in the eyes. Be warned that other conditions can also irritate the conjunctival vessels. What are the reasons for vomiting in relation to alcohol ingestion? As soon as the alcohol concentration inside the intestines reach a concentration of approximately 20%, an ileus will follow. An ileus is the main cause of the vomiting. If there is vomiting, it usually is an indication of overindulgence. Nausea is responsible for abnormal salivation. Salivation or drooling may also be a result of discoordinated swallowing reflex. It is therefore only found in severely intoxicated individuals. If present, they do need to be referred for overnight observation. The importance of checking for ear discharges is that any middle ear condition may have an impact on the balance and influence some of the observations made above. These include balance abnormalities, vertigo, nausea, ataxia, inability to hear questions or commands.
Just going to come and look at your ears quickly.
All right.
Right hand side, and the left hand side. Thank you.
Part of a clinical examination is the neurological examination. It is ideal to compare the pupils of a patient to someone else's pupils subjected to the same light conditions. Some reasons for unequal pupils may be an artificial eye pathology, or central nervous system pathology. Also be aware of head injuries associated with a motor vehicle accident. Mydriasis, or a widened pupil, may be present in early phases of intoxication, and myhosis, or a smaller pupil, in severe intoxication. Pupil reaction to light will eliminate the possibility of pupil size change because of accommodation. Be on the alert for cross reflex as well. Delayed, equal reaction may be indicative of intoxication. No reaction may indicate severe intoxication.
I would like to just examine your eyes.
Okay.
And to ask you to just look at the basin for me.
All right.
I'm going to shine this light from the side. Right eye. Thank you. Blink a few times.
Okay.
And from the left. Blink a few times.
All right.
Perfect. Thank you.
It is not possible to accurately demonstrate nystagmus in this patient, as this is a reenactment only. Caution: do not move an object being followed with the eyes in a too acute angle. The muscles of the eye movement will be stressed and nystagmus possibly elicited in a sober person. If this test is done accurately, horizontal alcohol nystagmus is one of the most reliable signs of intoxication. Once other rare conditions are excluded, of course. Some of these conditions include macular lesions, weak ocular muscles, injury to the cranial nerves 3, 4, and 6, cerebellar injuries, vestibular lesions, brainstem lesions, or high cervical cord injuries.
And then I'm going to ask you to keep your head still. Follow the pen for me. Side. Down to the middle.
Remember that coordination is the smooth recruitment and interaction and cooperation of separate muscles or groups to accomplish a definitive motor act. There are several tests that can be performed, and each examiner develops his or her own style as far as this is concerned. We can see the doctor here is doing the alternating pronation and supination, and the patient's own rhythm is awkward, incomplete, and even a bit slower. The doctor is also doing the fingers to thumb test. Other options include a fingertip to nose test, an open and closed eyes, as well as mirror test. Ask the subject to perform the same hand movements as you do. Just watching the patient do simple activities such as unbuttoning their shirt or picking up a pen can also be important. You can also ask the patient to write a sentence on the GW754 for later comparison. Each examiner must remember that they must write on the form which test they performed and not just tick the box.
Perfect, thank you.
Right.
I would like to ask you to repeat the movements that I'm showing you.
Okay, let's try. How's that, Doc?
The reflexes are not done in this patient due to limited time and space. Usually in alcohol intoxication, the reflexes are equally depressed. It is important to excite other reflexes during the examination, such as the abdomen or ankle reflexes, in order to eliminate or confirm the neuropathology.
Okay.
Romberg is a test for loss of position sense. Proprioception and semicircular canals in the middle ear are responsible for this. See how the doctor is watching the movement of a body in relation to a perpendicular object, like a corner of a room or door behind the patient. As you can see, in these cases, the sign is positive because there was swaying with the eyes closed, more than with open eyes. If there is severe intoxication, a positive Romberg can even be seen with open eyes or in a sitting position. Sometimes there can be very irregular swaying and toppling over. Exclude other conditions such as tabes dorsalis or spinal injuries. It is important to determine the intellectual and literacy levels of a subject. This is so that the doctor does not make a judgment call if a patient might, for example, be disinhibited, for example, their language might be different from the doctor, or they might have a different level of schooling, and that will influence the observation. For that, different questions need to be asked. For example, what happened, where did the roadblock occur, and even common questions such as, who's the president? Assessing the behavior at this stage of the examination is easy, and the options on the GW754 are self-explanatory. If a subject is cooperative, also state this. They can be more than one of these. This conclusion is based on the total picture found during the examination and interview, and not on a single symptom or sign. The validity of this assumption must be interpreted in conjunction with a blood alcohol concentration.
Great.
I'm just going to ask you quickly, do you know where we are at the moment?
I think this is Goede Skier Hospital.
Yeah, brilliant. And what day is it?
Saturday, no, Sunday morning.
Perfect. And what month are we in at the moment?
I think we're in March month.
Perfect. So thank you very much for your cooperation. I'm going to ask the officer to come back in again. She will recuff you and explain to you what's going to happen next. I'll give her my report, and completion time of the examination is 12:50.
Great, thanks Doc. Thanks for your help, eh?
Officer, you can come back in again. Thank you. I'm going to give you your GW 754 and then good to go. You just ask the nurse to make a copy for our
Okay, sure. Can I just go
notes as well. Thank you.
Can you stand up, sir?
Okay, officer. All right, oops, sorry.
All right. Can you put your hands behind your back?
Sure.
You tight, is it?
That's all right, thank you.
All right.
Thank you.
Just hold on.
All right.
All right, so you can go.
Okay, thank you. Cheers, doctor. See you soon.